when you have a diabetic, you're measuring hemoglobin A1C. And you're saying, hey, if your hemoglobin A1C is over 6.4, you're probably diabetic. If it's between 5.7 to 6.4, you're probably pre-diabetic. The problem is that hemoglobin A1C underestimates insulin resistance by 75%. You would never take a test in school and underestimate something by 75% and think you were right. And what's more interesting is your hemoglobin A1C actually drops when you initially become insulin resistant, because your body pours out insulin trying to compensate. And only when you get beta cell fatigue does your hemoglobin A1C go up. And most of the damage occurs to the nerves and to the blood vessels in the presence of high insulin. So you're actually, before your hemoglobin A1C goes to 5.7, because your insulin is high, you're getting damage right there. And that's why this peripheral neuropathy that you see, it precedes them having a hemoglobin A1C that's going up. They start to get these funny nerve symptoms, and they start to get stiffness of blood vessel, and they start to get increased risk for cardiovascular disease. And it does not at all correlate with the things that we think it should correlate with. We think that heart disease should correlate with LDL-C. And it turns out more than half the people that have a heart attack have normal LDL-C. And in fact, treating a high LDL-C only increases lifespan by 4.1 days. But it does with a statin. But it does increase the risk of diabetes by 20%. So the things that we typically worry about and the things that we typically look at as standard tools don't show us the data. What we did was we created Measura as an artificial intelligence to help us gather all of those data and those hazard ratios and put it all in one place so that you have actionable information and it happens to pay well. For example, in psychiatry, the average psychiatrist makes about $118.38 an hour. That's what their average take-home income is. If you implement a Measura protocol, it adds another $1,100 an hour, and that's as an ancillary service. That's not as a direct care that they have to participate in. And if you can get to the metabolic health, you can wean these patients off of their Xanax. You can wean them off a lot of their psych meds. In fact, 75% of schizophrenia is driven by metabolics, and they stop hearing voices as soon as you fix their metabolism. A lot of these patients have gluten sensitivity and they have leaky gut, and you'll be shocked at how many of your patients have leaky gut. And as soon as they understand the lifestyle implications and change, they stop having pervasive anxiety and they stop having histamine releases. And so those are the things that we're trying to get to.